Okay, hello everybody, and welcome to this live webinar that is taking place now in Kaohsiung at the IADS Annual Congress. So as you can see, then it is quite early in Europe, and here it's 11 a.m. But we can start off firstly with thinking about the oral health agenda of a new generation. So it is going to be a presentation and a discussion, which means that in the second half, please be very, very active and try to focus in the beginning as well and think a little bit about your education, what's going on now in the world and in healthcare, and hopefully you will enjoy it. So with us in this call, doing this live webinar is Dr. Julian Fisher, who is a dentist and a key opinion leader also regarding several public health and global health matters. So I'm going to switch now to Julian as well. Maybe Julian, you can say a few words about yourself, and then I can continue with also the introduction.
Sure. Greetings from an early morning here in Germany. I hope you can hear me well. I will try and speak more slowly. As Ava has said, I've been working for the last 15 years in global health, not just oral health, but global health. So very happy to be able to speak to young students about the need for young students and young dentists to get involved in global health. So it's really looking at some of the work that I've been doing, but really putting it in the context of your career and your future.
Thank you, Julian. So the overall goal of this this webinar, as I mentioned to you before, is to discuss and think a little bit. Why do we need change? What exactly is needed? And how can we be the ones who make the change for the future? So as you can see on this slide at the current moment, then we will be discussing what is happening at the moment, how will these changes and these trends in global health affect my working life and career, and the plans that I have made. So the goal is to make you think, question everything that you know so far, and also later on then, yes, discuss around these topics. So Julian, back to you to start off with, do we need change and why?
Very good. Again, as I say, welcome to everyone in the event. So as Ava had said, there's a question is, you know, do we need to change? And I think we need to look at sometimes, do we want to change? And probably the answer is generally we don't want to change. But I think there is so much going on that I think the environment, the context we're in, is going to mean that we're going to have to change, and therefore we as a profession and you as students are going to need to change and also to lead that change. I mean, I'm towards the end of my career, and the context that I practice dentistry in has been very stable and it's been quite predictable. But your context, your future working environment is likely to be very different to that that I worked in and how I'm working in. Your context is much more global in nature. It's much more complex, and it changes very, very rapidly. I mean, you only have to go on to a news and listen to the news to see that there are a lot of changes to the sort of national and international political structures. Norms that we've had for 40 years are seeming to shift and to change. So that whole political context is changing. We've got issues such as climate change and migration that my generation of dentists never had to accommodate and to account for. And for instance, in terms of climate change, caries, dental caries is a non-communicable disease. And earlier this year, air pollution became the 5th risk factor for non-communicable diseases. So you're then having to look at linking caries and oral health to quite macro risk factors. So you can see the whole environment is changing. The other thing is that earlier on this year, in April, Cape Town, a big global city, declared zero day for water, that they were going to run out of water potentially in April. And obviously, these are situations that dentists are going to be confronted with potentially in the future that my generation never even had to think about. So again, big macro issues that are touching dentistry. The last thing is perhaps the demographics. In Europe, there's an increasingly aging population, and in the Middle East, there's an increasing or a larger population of youth and young people. So again, changes both in regions and between regions. What I'm talking about is probably 1 million, or it sounds like 1 million miles away from dentistry and what you envisage in your dental practice. But I've been working, as I say, in global health for the last 15 years. And one thing in particular that I want to illustrate is the Minamata Convention on mercury that obviously has dental amalgam in it. And 10 years ago, I started working on this, this policy base for dentistry around dental amalgam. And a colleague said to me, Julian, we will never see the end of dental amalgam. It's so important, we'll never see the end of it. And yet this year in Europe, governments are now looking to ban the use of dental amalgam in children and pregnant women. So you can see that things that happened 10 years ago are now starting to come into and be a part and affect dentistry and your practice of dentistry. The other things in terms of health workforce, which is where I'm at Ave in Dublin, again, there's a big shift around the health workforce. What is the health workforce going to look like in the future? And the UN High-Level Commission produced a report and made some very significant recommendations that are going to change health workforce in the future. And particularly looking at education. So orientating education towards the health needs of populations. So again, how you're looking at curriculum is going to be defined by the health needs of those populations. And what does it mean to your future working environment? It's very interesting to hear and to see some of the early evidence that a lot of new dental graduates are going into corporate practice. And what is that going to mean for leadership, for defining the future of dentistry and oral health, and who's going to influence the political agenda? So again, education and where young dentists are going to practice are going to have a huge impact on the type of careers, the type of working environment that you're going to have. And with that, I'll hand back to Ava in the studio.
Thank you, Julian, for the introduction and to the first topic intro. So I think after listening to this, most of our young students and also young doctors here understand that global health and the trends are changing quickly, and very often we are maybe left behind. Maybe we don't know that much about it. And it's definitely time to start maybe challenging what we know so far, and trying to understand if we need the change and why we need the change. So as you can see, then one of the things we should be thinking of is how to accommodate to all these, let's say, conventions going on, all these meetings, these workforce discussions going on in global health, because as oral health specialists, as future oral health specialists, we are very often left out. So please try to think, what are we trained to do and what do we get paid to do, in a sense? So maybe Julian knows a little bit more than me about these topics, so back to you, Julian.
Ava, I'm not sure I know, more than you, but when I do teaching sometimes in dental schools and certainly out in medical and health education. And certainly in terms of dentistry, when I look at the dental undergraduate curriculum, there hasn't really been that much of a change from when I did my graduate studies 30, 35 years ago. It's still very much in the whole focused on restorative dentistry. And if you look at the definition of dentistry, and the American Dental Association has got a very good one, it's still very focused on activities. So how to do a root filling, how to put in implants, how to do crown and bridge work, still very focused on an activity, and the dentist is leading the dental team in that activity. And for instance, in the UK and National Health Service, they talk about units of dental activity. And the thing is, with activities, it makes it a very insular form of practice, and it's very difficult for professions from outside to be involved in those activities. And if we look at the definition of oral health, both from the World Dental Federation and also from the WHO, it's much more expansive, and it's much more about health outcomes. What do we want to achieve? How do we want to improve people's lives? And there, you've got the ability that the dentist can contribute to health, but also other professions can contribute to oral health. So again, it's opening up the whole space and accepting that other people are going to have to, other professions are going to have to be involved in oral health, and that will change the dynamics both of the profession and also our training. The other thing is, as Ava said, the second question about funding. Now, there is a lot of work and looking at health economics and funding of health. And Dr. Margaret Chan, who was the previous director of the WHO, said, what gets measured, gets done, gets paid for. And if we are measuring decayed, missing and filled teeth, that doesn't really lend itself to a more integrated, health-orientated type of care. And obviously governments are going to be funding that more holistic, more integrated type of care. And if dentistry is an outlier because it does activities, and the way we measure those activities doesn't lend itself to inclusion, again, your working environment and your remuneration for what you do may become more challenging in the future. And the other thing is the health workforce. You know, if there is no health workforce somewhere, there is often no health either. So, for instance, in India and in many countries and also areas, most of the dentists are in urban populations. And in India, 90% of the dentists are in urban areas, and very, very few, less than 10%, are in rural populations. So increasing the number of dentists from a government perspective and paying the dentist to do an activity isn't potentially the most cost-effective, or alternatively increasing the coverage in terms of oral health for their populations. So with that, back to Ava again.
Okay, thank you, Julian. So quite a lot of problems on a global scale regarding oral health came out from this part of the discussion. So it seems that for all these issues, we need solutions, right? So where to find these solutions from? Who should be the ones who actually know and know how to and know what to do? Should we be the ones? And what exactly are the solutions and actions we can take? And who do we need to work with? So, as I understand that there must be a lot of cooperation regarding these topics and regarding these things. So we need to be also able to work with other professions in healthcare, and certainly also outside of healthcare. So maybe, Julian, maybe you can tell us a bit more as young professionals. What can we do and how can we help? Maybe we can have words in our universities. Maybe we can try to change our educations. So maybe our curriculums. So what can we do exactly to find solutions to these horrible and not so horrible global oral health issues? So back to you, Julian.
Yeah, thanks very much, Ava. I mean, there are solutions. Probably the question I'd pitch to the audience, both online and out with you, is, do you want to take action? Do you as dental students, are you prepared to take action? So when I look at the blogs that we've done, we've tweeted on some of the big articles. When I've been looking at the data, the analytics, the Google Analytics, and some of the data analytics we have from the website, the majority of the people coming in and reading those articles and commenting on those articles are medical students, not dental students, which was quite surprising. But it does tend to be that if you, or if I write about oral health, the resonance comes from outside dentistry. So I do think there is a sort of a self-reflected element there. Do we really want to take action? Which is what I was mentioning at the very beginning. Do we really want to change? So I'm here because I feel, with my experience and with what I've seen, I think it is absolutely crucial that dental students understand that unless they get involved, unless they start to look for solutions, that environment, that working environment that you're going to go into is going to change. And if you're not part of that change, whether, as it says, Ava says, it's looking at curriculum change in your university, or more complex probably outside, but certainly looking at your undergraduate curriculum is going to be more challenging. Other thing from my perspective is, if you start looking outside dentistry, you open up career options. I mean, I've had a fantastic time working in global health, doing things that are perhaps not traditionally dentistry. I've got a dental degree, but that doesn't stop you working in many, many other professions. Often people think, I've got a dental degree, therefore I have to do dentistry. I've got two examples. There was just had a young Peruvian dentist go and work at the United Nations Environmental Programme. We've done a blog on it, and she's been working in areas completely outside dentistry. And she said that was a life-changing experience and career-changing experience, because she suddenly realized all the things that she could be doing with her dental degree. We've got a Australian dental student out in WHO at the moment working on non-communicable diseases. So internships, I would say, is a very interesting first step, and something I would encourage people to look at. I'm very happy to work with IDS to look at that. And again, following Twitter and Instagram, I can help communicate those things much more rapidly. And the other thing is, in terms of what are the solutions and action, the solutions, I think, have to come from your generation. I suppose my generation can only set things up and help you, but the impetus, the energy, the creativity, that needs to come from yourselves. And just responding to your question, Ava, I think some of the first things would be for IDS to develop an independent and strong voice in global health. What do you want? What future do you want? And so that students get engaged, not just individual students, but really the whole body of dental students globally get involved in this agenda. There's always the thing about funding. Well, we haven't got any money for this type of work and no one's interested in funding it. And I think that's a chicken and the egg situation. If you develop a very strong, transformative, creative, innovative agenda that really tackles some of these problems that we're looking at in the future, I think then funding will follow. And if you work with mentors, you've got people like David Alexander in the States, or other key people who've been working in these fields, if you can tap into that expertise, you will be able to develop a very exciting agenda that people will be keen to fund. I think, as Ava said, education, the undergraduate curriculum, that's where in the short term, you've got the best opportunity of saying, well, what do we need to change to prepare us for this future environment? You know, what do we learn? Who teaches us? Where do we learn? And who do we need to learn with? Again, those internships are an extension of that, learning to work with people and sectors outside health. So probably the biggest skill that maybe need to be looked at in the dental curriculum is much more about global health and advocacy skills. So maybe that's a suggestion that having a look at your curriculum and saying, it's great doing these activities, but are we talking enough about oral health? And are we talking enough about the skills that allow us to communicate oral health in a political context, both locally in our local community, but all nationally and also globally? And again, that means getting dentists out of their small box and turning them from starting to look away from turning and speaking to each other to turning outwards. And there's the very well-known proverb out in China that if you want to go fast, go alone. And if you want to go far, go with other people. So I suppose that's the key message. Look to start working with other people and creating this independent agenda of your own. So with that, I'll hand back to Ava in the studio.
Thank you, Julian, for the wonderful ideas. And I hope so far the things that you heard also made you maybe question and think a little bit more about your education and your curriculums and what you would maybe want to hear more about also during your studies. So we looked at the solutions, but we're going to move on now to a discussion spot. So this discussion has the aim of trying to get more info about what's going on in the world, because we have a lot of people sitting in this this hall from very different places or all around the world. So the curriculums are different, the minimal requirements are different if you study dentistry, and can they be improved? Is something maybe missing from what we know so far, and what can we do? So let's maybe start with a question that maybe somebody of you wants to comment on, regarding global health and regarding public health. How many lessons do you have, or do you hear about it? Do you study about it during your studies? Do you maybe have some lessons together with the medical students or nurses or pharmacists? Or is it just straight on dentistry and medicine is separate? Is there any interprofessional collaboration during your studies? Also, maybe, are you trained to do advocacy in your national associations? Or do you do in your dental student associations any courses on, you know, how to go, how to advocate, how to talk about oral health all around? Or is it still very technical? And as it came out from Julian's discussion as well, that it is a big problem very often. So maybe somebody would like to start off with saying how is your, like really briefly, nothing super long, but just basically how is your dental study going on? And do you have any global health, any advocacy maybe, or any interprofessional collaboration? You can, you know, snatch one of the ideas and say, like, for example, do you study together with med students some things, or how is it? So well, maybe Portugal wants to start.
Hi. My name is Diogo. I'm from Portugal. And the curious thing is that in Portugal, it doesn't work the same way in all universities. They're very different between each other. This way? Okay. For example, in my university, dentistry is inside a medical school. So it's like medical school with the classical medical degree in dentistry. So we have many classes together, and we work a lot together. We have a pretty heavy education in public health. We have epidemiology. We have a special class for how to talk to patients, teach patients how to do prevention and everything like that. So, but this is my particular case, and one of the things we discuss in Portugal is why is dental education so much different between universities in the same country? Is something we are discussing. We in the national organization, National Students Association, we are trying to create a curriculum which would be the ideal curriculum according to Portuguese students, so that then we can advocate in the universities that all the curriculum should try to follow that guide we are trying to create. So this is something we have identified, that they are very different. Have a very heavy education in health, but not all of them have, and not all of them have this integration with medical schools. So it's actually a very curious thing, I think, about Portugal. Thank you very much.
Thank you, Diogo. So we heard that in Portugal things are not that bad. You have it's a part of the medical university, and the education is also together with the med students. Is there anybody in the audience maybe who can say something completely different? That your studies are very strictly only dentistry, very technical. Okay. Okay, so everybody kind of agrees that it's still a little bit broader, right? It's curriculum, at least in Europe. How is it in Asia? How are your, what would you say? So, I see, okay, I'm gonna use the microphone.
So I'm from Thailand. Actually, luckily, we just had the Asian Student Forum. So we gather all each delegate from Southeast Asia to talk about the curriculum in each country. So this is a summarize a bit for Southeast Asia. Start with the Brunei. They just start their dental school. Like they have only 1 year right now, the year 1. And also the Cambodia, that's the total year is 6 years. Oh, 7 years, sorry. So 7 years for the dental course is a bit long, right? For the dental one. And also not enough facility in Cambodia, that's as I know. And for the Indonesian, I think they need to pay for the dental treatment for their patient. Yeah. And maybe Laos, they don't have basically supported enough. And for Malaysia, they are trying to do their paperless one, the record system. And they try to use the CDAS. Do you know CDAS, right? Yeah, so it gonna change, but there's some problem again. And also they don't really focus in geriatric dentistry that much, because right now the geriatric dentistry is very popular and they will be changed so soon. And for the Myanmar, there's somehow like all the data update maybe, and maybe Philippines that I know from the PDSA Association, Philippine Dental Student Association. They said that they lack of instruments, some kind of dental chair you need to share with your partner, and like a research database also. And from Thailand, I think it's all Asia. They have a language barrier for sure. That's quite hard to let us know and up to that for the knowledge. Yeah, I think that's the second dialect is.
Okay, thank you, Paul. So I quote from here, of course, that different countries in Southeast Asia have different problems, but also there's the issue that there is a language barrier. Regarding, let's say, advocacy in global health, this is also something that that is an issue if we talk on a global scale, that some countries are kind of more easily can be caught or brought into this advocacy and all these trainings. So this is something that also needs attention. But going back to the topic a bit more, then Julian mentioned before some things. So one was the Human Resources for Healthcare Forum that was happening in Dublin last year. It's a WHO event they organized. So this is something that where they discuss workforce and health workforce. So I would like to know, like, do you discuss these issues also in university? Do you discuss, for example, that in low middle income countries there isn't enough dental workforce, that it is an issue in your country? Do you know what's going on actually in regarding dentistry and regarding oral care and prevention? What is your country doing? How can you join in? Those kind of things as well. And also he mentioned, for example, the Minamata Convention. So the Minamata Convention is regarding mercury and regarding kind of banning mercury on a global scale, right? So as we know, then dental amalgam is something that is used a lot in dentistry. It's one of the dentistry is one of the highest user of amalgam in the world. So this is like a toxic waste, and it's not good for the nature. So so all these things are actually happening, and it seems that we don't think about it that much. So it's kind of like background music, right? So we are focused very much on our dental studies, our technical studies. Of course, we know about medicine, we know about health and things like that. But we also know about health policy, and are students interested in health policy? So maybe somebody would like to answer to the question: are you interested in, let's say, the health or healthcare policy work as well? Let's say not the paper work, but regarding the discussions rather. That you discuss with medical students, you discuss maybe with doctors as well, healthcare in general on a global scale. So kind of looking out from dentistry, but taking dentistry and bringing it into the global scale, into the discussions. Like, are you doing this at the moment or not? Have you thought of it before at all? Or all these things we've been talking so far are very new information for you? maybe somebody would like to comment. Maybe Czech Republic. Yeah, well, I don't know, in the Czech Republic. Yeah. In the Czech Republic, it's not really. We don't do that. Like our students don't discuss anything with pharmaceutists or medical students or anybody. So, well, we might be interested, but we don't have a chance to get in touch with them and to speak about it, which is problematic. But we don't have any, like our school, for example, is like medical and dental school, but we don't have even classes together. We don't discuss anything together, and like we don't have any chance. The only thing we are now trying to do is, for example, that our association teaches like medical students about oral health somehow, but like usually when we do some event, they don't really like appear in a big amount of students. That means that they are not probably that interested, or we are not sure. That's the main problem, I guess. But we are trying, but it's hard. Okay. Yeah.
Hello everyone, I'm Corey from Taiwan, and I'm from Taipei Medical University. And I would like to share our experience in Taiwan. Because in my college, Taipei Medical University, there are medicine department, dentistry, and nursing, public health, and like nutrition. So we have a lot of service team for Taiwan and also Nepal or Switzerland, right? And there is someone come back from Switzerland. He is a how to say? He is military, but he is a representative of Taiwan to Switzerland. And I would like to introduce you to listen to his experience later. And I would like to share my experience in Taiwan. Okay, thank you. In our service team, it's like a club. We will gather students from medicine department, nutrition, public health, nursing, dentistry to give some free medical service in some rural area in Taiwan, because Taiwan has some rural area, not like Kaohsiung you have seen, like Taidong, like Hualien, some places in the mountain, in the rural area that their health knowledge is not like us. They don't know they have to brush their teeth. They don't know they have to get scaling half an year. Yeah. So our duty is to tell them you have to do this. Maybe we can give them some toothbrush, toothpaste, but we can't always give them these things. What we can do is to tell them you can go to your nearest clinic. Like they have to take a bus for about 2 hours to the city. It's really far. Maybe the distance is not far, but the time distance is pretty far because they are old. They don't have mobility. They have to take bus, and rural area is not that convenience. So what we can do is tell them you have to have this information. You have to know this. And whether they do so, we don't know. But what we can do is go there, give them these kind of information. And now I would like to introduce Dr. Wu. He has come back from Switzerland. Yeah, his experience, I think, is pretty special.
Actually, Swaziland now is called Eswatini. It's a small country in South Africa region. Actually, they have no their own dental school or dental department. Their dentists only have to go abroad, like go to Russia, go to Cuba, or go to South Africa to learn dentistry and then come back. So, as I know, they only have around 10 dentists in their country. So so they need more dentists in their country, and then they need more oral hygienists to give the children or their people have how to brush their teeth. Yeah, I think it's much more important than treatment. Yeah.
Thank you. So this was very interesting, actually, because I heard from here now that in rural areas especially, it's more necessary to have hygienists, it's more necessary to have a workforce. Maybe it can be a community health worker who can do the basic work, the basic prevention, the basic knowledge, right? So this is the way to maybe how to get things better in those areas where there's only 10, let's say 10 dentists in one country. You know, it's crazy, especially coming from Europe, if we think we have so many dentists, in some countries even too many, you know? And at the same time, there are countries where there's one dentist per million. So these are kind of the workforce issues we should think about a little bit as well. It's very nice to hear that the Taiwanese students are together with nurses and together with medical students. They go abroad and they actually help the communities. They do volunteer work. This is also something that the students could do. I would like to ask now Julian, maybe you can comment a little bit on it, because we have to start wrapping up a little bit as well. We're shortly running out of time. So did you get the discussion, and what do you think about it? How does it seem to you?
I mean, it's very interesting feedback. So all the sound stuff. Portugal and the difference across all the different dental schools. I think the global agenda that both Ava and I have been perhaps a part of will start looking at standardization. So in Portugal, there are going to be accreditation standards, there are going to be national accreditation systems. So that's one thing you may want to look at, accreditation systems at a national level that will make sure that, or try and harmonize all these different variations of the dental undergraduate curriculum. And I think that's something that students can drive as well. In terms of the last speaker and looking at the numbers of dentists in country, I would imagine that large numbers of countries have acute shortages, particularly of dentists. So for instance, in Kenya, there are 1,000 dentists for 44 million people. So the question we posed at the very beginning is, do we need to change? Maybe we can differentiate. Does the profession, the undergraduate curriculum need to change? It's kind of very interesting to hear that, and maybe this is just only my impression, but there's a feeling perhaps from the audience that maybe in terms of the undergraduate curriculum, you feel that there is no need to change the undergraduate curriculum, but there may be a need to look at health workforce. So who would we work with to improve oral health? So I think it would be very nice to do a survey to start understanding some of those issues, because as I say, the agenda is changing, and there will be things coming down the pipeline that unless kind of students or the dental profession engage now, it may be too late in 10 years' time to start changing some of these policy initiatives. So I think a survey to get some more detailed information and really focus in on a few areas where dental students feel that's something we need to tackle, I think would be an exciting idea to roll off the back of this meeting. So over to you, Ava.
Thank you, Julian. I agree that we can collect a lot of information from all of our members and all of the students as well. So as Julian mentioned before, it will be very interesting to do a survey, a short one, just a questionnaire together from all of you and from many of our other members as well, information about the education, and to get like a clear overview, what is going on and what can be improved. So you will hear shortly more about the survey later on, and I think we will going to wrap up now slowly. So thank you very, very much, Dr. Fisher. The local organizing committee has also made a little thank you note for you. I'm going to show it later on. It will be posted to you. So thank you very much. I think that this discussion was important because these are the issues we don't talk about normally during our conferences, which is very, very sad in my opinion. And most certainly tackling actual problems regarding workforce, regarding oral health, regarding the way we think as future dentists, it's something important. So thank you very, very much, and we hope to hear from you soon.
Well, thank you very much, and thank you for the patience during the the link and the you know, this live webinar organised. So thanks very much, Ava, and the team in Taiwan.